Partnered by Times Influence.
Hello and welcome to a special show called Resolution Against Pollution, a special initiative brought to you by Sanofi and the Times Network. We all know that the state of air pollution in this country is far from ideal. But to shed more light on that topic, to see how it's affecting us, and to see what are some of the steps that can be taken to solve this problem, I have an esteemed panel of experts with me. Allow me to introduce them to you. Dr. Sanjeev Mehta, chest specialist, Leelavati Hospital, Mumbai. He's also the founder of the Lung India Foundation and state chairman of Indian Chest Society. Dr. Seemab Sheikh, ENT surgeon, Pune, and the founder national president of Indian Association of Surgeons for Sleep Apnea. Dr. Deepak Haldipur from Bangalore. He's been an ENT surgeon for 27 years and is the president of the ENT Society of India. Dr. Animesh Arya, chest physician from Delhi and the founder president of the Indian Society of Respiratory Infection. And Dr. Sitesh Roy, a US board certified allergist, immunologist and asthma specialist and the founder of Dr. Roy Health Solutions Clinics, Mumbai. Pollution, it's easy to say things are bad, but could you put it into perspective? What is the scenario currently and how is it compared to last year or the last few years? How are we progressing? How are we faring?
Pollution means the solids and the liquid particles which are suspended in the air. They are going up in numbers as well as in the quantity, and we are measuring that by two indices, that is the air quality index, and which has been deteriorating over the past successive years, particularly in Indian continent. And this has seen a 54% deterioration in the last 4 to 5 years in India. And to say that how we are faring in last few years, definitely the AQI and the PM25 levels have gone up since the last 1 year.
Okay. Dr. Haldipur, Dr. Arya mentioned the AQI and the PM 2.5. First, I want to come to you about the AQI, Air Quality Index. Can you simplify it for the layman?
It is the basic measure, just like when you have a measure for BP or pulse or heart rate. When you look at pollution, you always talk, especially we compare the cities.
Yes.
And when you have to compare, you need a certain unit or a standard of measurement. And this air quality index is one of that. The major cities, in fact, to summarize it in a simple way, the World Health Organization has got a certain ideal standard. And you would be shocked that the study done in 168 cities showed none of them are up to the standard.
We think that the villages would be much better because we all talk about vehicular pollution, but no, this biomass fuel. Another microenvironment which I want to talk about is the homes where we have these chulas and no exhaust. And in that small micro section, that environment, the levels go beyond 500, 600, 3 times a day. Every meal, the levels go beyond 500, 600. It's a disaster. So while these indices are good, and I think they are very important, like everybody should be aware of these indices, like everybody is aware of blood pressure and sugar, and we should all work on that. We also need to get very specific about the microenvironments where these indices could be far out of proportion, and that's where the danger lurks.
To add on to that, it's more like you need to know and you need to be aware, but the reason why you need to be aware is that the particulate matter, the pollutants that you're talking about, these are so small in size that they filter down right into your airway to the lower levels of your lungs.
That's what's called PM.
PM, that's the particulate matter. They go deep down into your lungs and they cannot be brought out from there. So the damage that's done, they stay there. There's no drug therapy to get them out, there's no suctioning to get them out. So these are the danger particles. I mean, that's why the indices and the need to know of what to be monitored is really important.
So definitely need for more awareness. Yeah, Dr.
And just to bring this in a global perspective of where we stand, even the most polluted city in the United States of America would have a PM 2.5 rating of about 18. whereas the most polluted city in India would have a rating of about 160 to 170, where 10 is the normal. And even in a busy city like New York, you're looking at a PM 2.5 about 9, Tokyo 15. So we clearly have a major issue here that we are dealing with that really requires attention from all of us.
I want to move on to what we call allergic rhinitis. So, Dr. Roy, if you could start off with this, could you shed some more light on what that is and why should we be aware about it?
Sure. So, allergic rhinitis is a spectrum of symptoms that is characterized typically according to people with sneezing, runny nose, blocked nose, stuffy nose, sometimes with itchy or watery red eyes. It can also be associated with itching of the throat, palate. And so these are very common symptoms that commonly people would look at as having a cold.
Right.
And so allergic rhinitis is estimated to be affecting anywhere between 20 to 30% of the Indian population and even higher in some of the Western countries. And given that many people believe that it is a runny nose and a cold and sneezing, it often gets treated by primary care physicians as a cold with antibiotics, whereas allergies is not something that is treated with antibiotics.
The problem in our country, and the one that really needs to be addressed, is that allergic rhinitis is not considered a disease. Half of you, in fact, would treat it as, okay, it's a cold, it's something, and I'm going to go to work. But what it does is, like he said, the incidence is so high that it reduces the productivity of a nation.
Dr. Arya, I want to come to you on one point that Dr. Roy also brought up, that this kind of allergic rhinitis is not just caused by outdoor pollution. Indoor pollution also plays a very important role in this. Is that the case?
So you're absolutely right. So because it's a common myth that the indoor air is cleaner than the outdoor air. But in fact, the indoor air is 2.5 times as polluted as the outdoor air, because we have our micro pollutants. We have a lot of cooking gas burning. That's a usual cooking medium, and that creates a lot of oxidative stress and ozone production in the environment. And then we have burning of basically, or emitting from the cleaner detergents, and burning of mosquito coils. So all these factors are also stresses as well as allergens which provoke an allergic reaction.
Dr. Mehta, I want to get you in on this point. In this tech-savvy world where people are doing self-medication, how do you guide them on this, that everything that they read on the net might not be the correct symptoms? They need to identify their condition and take the right medication or take the right steps.
You put it nicely. I'm so used to now being the second opinion after Dr. Google. So that's fine. I think as doctors need to evolve. But before I do that, I want to reinforce what Dr. Arya just said. And I think this is allergic rhinitis is the harbinger for asthma. And this is a very important intervention point for the patients and for the doctors. And if you could take care of it initially, don't underestimate it. You could probably prevent a problem happening much later. That being said, I think you're talking about how we can help the patients with the technology. And I think it's time for us doctors to use technology well. I do guide them to appropriate good websites where they can get good knowledge. Guide them to appropriate use of medication. We also give them guidance in terms of how they can do avoidance of allergens. I think that's so important, because some of these, not all, but can really be avoided. So if we guide them well, use the technology, then technology becomes a friend rather than something that confuses the patient.
Okay, very well
And
point.
I would like to add one thing to that. I think that once a patient recognizes that they are having recurrence of symptoms that are indicative of possible allergic rhinitis, it becomes very important to seek the right specialty care so that they can be allergy tested, because there is a lot of loose diagnosis of allergic rhinitis that also happens, and there is also underdiagnosis of allergic rhinitis. So both ways, patients who may not have the problem think they have it, and patients who have the problem never get tested. So I think that one important message for patients to know is that there are very good accurate tests that are available for the diagnosis of allergic rhinitis through skin testing and blood testing done under the guidance of a super specialist, which can help them identify their exact triggers and then give them the right direction in terms of what they need to avoid, not general avoidance, which is what is sometimes done, and also specific therapies that can get them out of the disease.
No matter what you do, Google cannot replace a doctor.
Of course, that's true.
And this is one of the simple cases where education is becoming detrimental. It is better that you are an illiterate person, then you are more likely to go to a doctor directly.
Exactly.
And one more point which we are probably missing out. The commonest is this house dust mite allergy.
Right.
So when you're talking about the indoor pollutants and irritants, the commonest allergy we see is house dust mite. And simple measures like, ironing your bed sheet, pillow cover, or wherever sunlight is in abundance, drying that,
Yes.
keeping your rooms dust free, don't keep articles which attract dust, goes a long way in preventing these allergies.
Okay, interesting.
The tests apart, the simplest thing is see a doctor first.
Dr. Mehta, is there any specific demographic age group that is most at risk, and how do you guide patients that come to you, who might be of different ages that come to you?
Sure. I think the most at risk are the younger ones. See, earlier in a growing lung, the damage takes place. The more impactful is the damage and more persistent is the damage. So give an example. Now, if you have, we know that even if the father smokes when the mother is pregnant, the fetus inside, the mother is not smoked, the fetus inside undergoes damage for the rest of its life. See the impact that it has had for all time to come. In fact, there has been some studies that have shown that if the lady smoked, her granddaughter can get asthma, and this sounds controversial, but this is because of methylation of the genes that takes place in the daughter, and that predisposes them. So I think that impact is very clear. The earlier in your life, the exposure, the worse the damage. And they are unfortunately the ones who get a lot of exposure. Nobody even looks at them. They think they're playing. They get exposed to it and their lungs don't even grow to normal size. Please remember, unlike most organs, the lungs are growing to the age of 20.
The elderly age group above the age of 55 or 60 is just as susceptible for major illnesses as the very young developing child who's just learning to respond to his environment through his immune system, which is his window to learn what the world is like.
Dr. Arya, let's get to first managing the chronic condition. I mean, what is the short-term impact, medium-term, long-term? How does that work?
To begin with, as Dr. Roy said, allergies and the immunity play a very interactive role in the initial formative years of life. And we have a thing called allergic cascade, which starts from the early age group and mounts till the adolescent, and you have a established allergic profile by that time. Whether you are destined to be an allergic asthmatic or only destined to be allergic rhinitis with maybe some sinus symptoms. So the prevention or the therapeutic approach starts right from the beginning. First of all, it's the avoidance of exposure to allergens and to the pollutants altogether, particularly the indoor allergens, the house dust mite, and control of indoor pollution. And then comes identifying the allergens, and particularly, as Roy said, about identifying with various newer tests where you can pinpoint the allergen and then avoiding them in total or in partial. And then comes the specific therapy, immunotherapy, and of course certain group of individuals who are kind of very, very affected with allergic rhinitis. They could use a barrier like a mask or something in particularly high pollen season or in high intensity pollutant areas or in their working environment. So if they cannot move away from the working environment, they just use a barrier mask. So that's very important. And then comes the therapeutic part.
Okay. Sorry, Dr.
See, Sumit, I think one thing very important that every patient of this chronic disorder has to understand is that it's a chronicity, it's a chronic disorder, right? We have a tendency in our country to say, oh, I have diabetes, I have allergy, I have to live with it. I have asthma, I have to live with it. See, the point here is we are not, these are disorders which are not going to be cured. You have to live with them, but the idea of treatment is to give you an absolutely good quality of life whereby this disorder prevents you from hampering anything that you do in your life.
See, the bottom line, bottom of all this is our civic sense has to improve. if you are an industrialist and you should really be bothered about what is the kind of smoke your industry is giving away. You are a smoker, you are cooking at home, you have a vehicle which is bringing out emissions. So each one of the biggest problem in this country is how many of us are actually thinking on a day-to-day basis that what actions we are taking individually, is it affecting the society at large in the long run.
Dr. Mehta, another pointed question to you. The disease has evolved. The pollution unfortunately has deteriorated over the years. Has the medication, has the treatment evolved?
One of the things is that the medicines have definitely become much easier. Second, diagnostics has become more advanced. Third, we can give specific therapies like specific immunotherapy, which can completely alter the life course of the disease. Now, the tablets have become much milder, gentler, less side effects. Like the new medicines, there is no sedation. You can take it and go to work. So I think there's a lot of things we can do for our patients.
Dr. Haldipur, if you could help me with some of the do's and don'ts that people need to keep in mind.
Very simple. See, I get a huge score of allergic rhinitis patients because I'm an ENT doctor. A simple thing like wearing a mask when you are driving. I'm not saying wear it through the day. All of us, you know, iron our shirts every day. We're obsessed with it. How much time does it require to get your pillow cover and bed sheet iron if you're an allergy patient? More than air purifier, you have a room heater which heats your room 3 times in a week. Your dust mite count comes down.
The first thing I would suggest the viewers is not to have an ostrich-like attitude towards these disorders. They have to recognize this as a disorder. They have to recognize the fact that it is a completely treatable and absolutely getting you back to the good quality of life kind of a disorder. And the most important thing that you could do is prevent this disorder from happening.
Sunlight is your best friend. So let that come in. It kills the dust mite. It kills the fungus. In Mumbai, there's a large fungal load which is probably not seen in any other city. You've got to fight pollution, indoor and outdoor, not for your neighbor, but for your own lungs, because you are breathing that air. And if you and your children continue to breathe, it's going to be really bad. So medicines are great, but the only way to do it, for the whole world has done it, you've got to improve the quality of air that you take inside your lungs every day.
Dr. Arya and then to Dr. Rao.
As we said that we should control pollution. So most important would be, as we said, about burning fires and firecrackers. So the garbage which collects outside, you know, after you have cleaned the house, invariably the sweeper would tend to light it up and burn it. So the smoke emanating is a big pollution. And particularly it mounts over the festival season and immediately after Diwali. So that's very, very important. We should shun from such activities and we should control that as an individual, as a policy maker, as a program deliverer. So that's very important. And then of course seeking a early treatment with a qualified doctor is the most important.
We are primarily talking of air pollution, but when I as an immunologist look at the human body, a large part of what our immune system does is dependent on our diet. And so what we eat, and there's tons of food adulterants, food contaminants, food preservatives, which are passing through our FDA left, right and center, which is causing immune damage very early in life from within, even before the baby is born to breathe air, because it's going through the mother's diet. And so I think that the entire country needs to wake up to realize that westernization of diet and lifestyle is a very big reason why the rise that we saw in allergies and asthma in the US, UK, Australia in the years of the 60s, 70s and 80s, we are now seeing in the 90s and 2000s. And so diet is a very important part. Air pollution, we all have to have a personal commitment to reduce what is called our carbon footprint.
Yes.
And so if we become aware of what our day-to-day life is like and where we are adding to the air pollution, I think we can make the biggest impact as a society for the whole country and for every other human being around us in the long run.
Every place has something called as a geographical intelligence. The robe that Arab wears or the diet that South Indian eats, it all is years of intelligence which we are rediscovering now. So I think Sitesh made a very good point that westernization is not the answer.
Just copy, blindly
not
copy.
At all, not at all, which is what we are doing.
Fantastic. Thank you so much, gentlemen, for talking to us. Thank you so much for watching. You've been watching Resolution Against Pollution, an initiative by Sanofi and Times Network. And I really hope that you have taken some pointers from here, simple things that we can do to ensure our lives, the lives of our loved ones, are improving as we go ahead. Just whether it is visiting a specialist, whether it is taking care of the air we breathe to improve the surroundings. I'm making a resolution against pollution, and I hope that you are too. Thank you so much for watching.
Partnered by Times Influence.